do that to me. We are on, you're live. It's 9 a.m. on October 7th. This is the Health Committee. And let's call the meeting to order. Do I have a motion to approve the agenda, please? Steve Hughes.
I'll second.
And Funny Boy here. Okay. Any public comments anywhere? Well, I should say we're waiting on Joe and Angie a little bit here, and Jody won't be with us today. Do you want to call the roll? We don't have that on here. I guess we should have done that. We'll call the meeting to order. It's up to Angie.
Hughes.
Yeah.
McGinnis.
Yes.
Bard.
Yes.
Grant. Pro.
Yes. Okay, that's good. Have you heard from Angie this morning?
Have it. She should be on her way.
That's what I think. She'll be coming. Okay. Why don't we begin with our agency reports? We'll start with the Mental Health Center and the VA. It was my understanding you two had talked between last month's meeting and this month's meeting. And I believe the question at hand was, with the new grant money for first responders and veterans, how is that being utilized with the VA paying bills? Is that correct, Jennifer?
Yes, in a way, but we've spoken. I think it was mid to late last week.
Why don't you fill us in on the...
So I will first preempt this as Chad and I spoke as well because I had questions with that. So, and my brain is foggy, so I apologize for that this morning. So there's two different programs that I understand. There's the treatment aspect of it where the VA would be billed if they were seeking mental health treatment through Iroquois Mental Health. And then there's a peer support group that is completely separate from that. And that's where I think a lot of the confusion was coming in at. Am I correct?
Yeah, I guess I would like to know what was the origin of the question. Where is this coming from?
Well, I think it just came up when Jen asked Chad, myself, Paul, how's the grant money being utilized?
Okay.
And we, of course, didn't know that. We knew, but we didn't know there were two parts to this.
Well, so Iroquois Mental Health Center is a community care network provider. So any veteran that comes to us, either through a VA referral or on their own, if they have VA benefits, we bill the VA directly. Just as any person, whether they have a pay source or not, that's a direct relationship with the client and the pay source or lack thereof, and then we make arrangements.
When you say pay source, do you mean like insurance and employee?
Insurance, Medicaid, self-pay, whatever that may be. So whoever is paying, whether it's the client or somebody else. So that's been an ongoing scenario. We are able to bill the VA directly on behalf of a veteran. So that's present whether we have a grant for some other activity or not.
And that's true with care in the community, no matter what the pay source is.
Yeah.
Community care is not a grant. It's just based on geographic location, how many miles you are from a care facility.
Or if a care facility even has a psychiatrist or a PTSD clinic or anything like that.
Whoever was calling it a grant is incorrect. It's not a grant. It is.
Well, community care is not a grant.
Community care is not a grant, but that's what they were confusing.
Okay.
They were confusing.
Understood.
Yeah.
Understood. So that remains the same as
Sure.
it's
Yep. That's an ongoing thing that doesn't ever change. We have specific therapists who are credentialed with, and all of their information is connected to the VA, so that when a VA call or a veteran calls and says, you know, the VA has sent me here, we know this, and this therapists are available to see that client. So that's ongoing. That's not a grant. That's not an exception or special management.
Okay.
We do have a grant from the federal government that is specifically for first responders and suicide prevention. We have been able to allow to and encourage to include veterans in the promotion of that program, because there's a lot of synergy between first responders and veterans. They are often one and the same, right? So we've scooped up the veteran language in addition to speaking to veteran groups, because the grant offers funding for marketing, peer support groups, and education, not
Funding, peer
clinical.
support groups and education, and this is the suicide prevention.
Correct.
Okay, go ahead, I'm sorry,
So-
just,
So a lot of very different activities going on, and that's the case for us on an ongoing basis, because either at the end of December or at the end of June, we don't know yet, based on federal funding, that grant will end. And so then it's our responsibility to determine whether or not we can continue with those services, which we plan on doing, at least the peer support piece. So we will occasionally have grants that allow us to do additional activities over and above services, but services is our core activity. Our core mission is to provide those hourly services to clients. So, yeah, the community care network piece, that's a part of our pay source structure. That's a foundational.
Yes.
I was just.
And it's completely separate from the peer support group thing.
So with the peer support group, that's the one that's gonna end December 1st or June,
The funding might end.
funding depending.
Right. Well, the funding will end. It's either going to be at the end of December, end of June. It was supposed to end in July, then it was extended to December. Because of the changes with the administration and funding availability, some people are abstaining from spending money and some are. And so they've said, hey, we don't want this money to go to waste. So of the 7 agencies across the state of Illinois who are doing this program, who wants what's left? And we've said, we'll take our portion, what's appropriate, so we can continue to not only provide a peer support group, but also promote it and continue to educate.
So I guess what I'm curious about is I understand the community care, that's part one.
Yeah.
But over here with the, words just went out of my mind, the grant funds, can you share with us some of the ways that that's being used for first responders and veterans and the things you just mentioned?
Sure. So, we have a program coordinator that provides mental health first aid training. And that's a certified program, so she's an instructor of that. She also provides QPR training, which is question, persuade, refer. That's a training for first responders, teaching and guiding people on how to understand, recognize, and then help somebody on next steps towards mental health services. And then CALM is another acronym for a training that she can provide, which is, I don't remember what the C is, but it has to do with coaching and teaching on people who have access to lethal means of suicide and educating on that. She distributes gun safes and gun locks to first responders in the community and makes personal contacts there. She's training our CANCOM and 911 for Iroquois County. And
so when they would, for example, get a call for someone who's clearly having, I don't know, I want to be, a mental issue, then they're trained on how to speak with that person.
the training is targeted for the first responder themselves.
Okay.
Our target audience is the person answering the 911 call, not the person calling into 911.
Okay, got it.
So this program is designed to support police officers, sheriff's department, fire department, people who are answering the phone at 911 and carrying the weight of the information, that they're receiving on a regular basis.
Experience from the people on the front line. So the Army, we use Living Works and QPR also.
Mhm.
And I was a trainer, so we would train the people that are living with them every day on what to do if they discover the signs. It could be anything. And then the biggest push is just ask. How you doing? Anything about hurting yourself? it's so critical, and I know this is being recorded, that's why I'm saying it is so critical to ask the question.
Yeah.
Are you planning on hurting yourself? How, you know, and there's multiple ways, you just have to ask.
Well, this is
So-
great. I think I'm
And-
starting,
911, they're the ones that might receive the call from the person that was asking the question.
Right.
Or they might be the ones receiving the call from the person who realized they need help. And that's a totally different animal because you are disconnected, but connected, and you still go home with that baggage. And, you know, it affected me because I was the one doing the suicide interventions, dealing with my own garbage from the war, and it started to compile, and there was no help for the provider, you know.
And I can
So-
second that because the stuff that I deal with kind of set off some triggers in my own mind where I've had to seek help myself.
So,
well, and I think I'm understanding, you know, so many times we'll get a first responder coming into a situation and not being trained to handle. So this is
Yeah,
going to
it's
help
good.
them
and
help
Here-
someone else.
here-
Well, I want to be clear, this isn't training for a first responder to know how to respond to a crisis. This is training for the first responder to know how to manage all the weight and the information that they're receiving. It's just like secondary trauma. So
Okay,
maybe I'm not observing the car accident that just happened because I'm on the phone with the 911 call, but I'm still receiving and taking in all that information, and then I hang up the phone and I answer the phone for the next situation, and it's over and over. And so as a 911 responder, I'm just taking in all the trauma that's coming at me from all these different directions. So it's a very specific audience.
it's targeted.
Right, yeah, and like Chad was saying, he had to get trained, and some of that training would come from folks like us, but mainly from other people who can give him the certification for all these different classes. But we're really focusing on the first responders themselves who carry a huge weight. So the grant money is for that kind of training, as well as any supportive family members of first responders.
Okay.
Yeah.
Well, I
And
think
they
that
do a lot in the
clarifies
community.
things.
What Airport Mental Health Center does, they do a lot in the community. They have really, over the past few years, stepped up the game and trying to support the services that the county provides, 911, the jail. They've really stepped up. Okay, some of the stuff I think is coming from a potential competitor in the mental health arena from up north. Okay, I'm just gonna say it because it has been there. Totally different entity.
I think I know.
Yeah, totally different entity. They do, and I'm not saying that that's the fact that just, you know, and within the service arena, it's a very competitive arena. So providers, it's competitive. People don't realize how competitive it is, but it's a very competitive arena. So when we hear, you know, complaints, we just have to be very delicate in how we take it in and then just ask the direct questions.
Well, and
So, and that's what we're doing is fine because
Yeah,
it's
and
getting-
I was also approached too, and I did what I was asked to do. And, you know, I laid out what I knew as gospel on the VA side of the house, but I was also confused as to where the grant money came into effect at and what it actually provided for. I wasn't given all of the facts.
well, I hope this clarifies. I thank you both for working together.
And I don't have any animosity whatsoever. I was just,
Oh, no, I
No,
don't
you're
think
fine.
that. We were just
This
looking
helps.
for more information. I didn't get the feeling anybody
Yeah.
was critical or anything. We just, additional questions popped up. And I thank
To
you
help
for
the community.
clarifying that because I think first responders and veterans are people who are very near and dear to all of our hearts.
and I would also like to add, a lot of those first responders are veterans as well that are going to the veterans crisis or what have you.
And they become law enforcement and firemen and EMTs and 911, telephone telecommunicators. Okay, I think unless anybody has something else, we'll move on to,
Don't forget the farmers this year. this is the time of year the suicide rates increase for farmers.
This is true,
So
and it's.
350% increase.
Okay. All right, Robin,
Yes.
you're up.
Thank you.
Thank you, both of you.
Thank you.
Good morning, Angie.
You
made it.
Yes.
Okay, Robin.
Have a wonderful day. If you check, I'm moving to.
Environmental health, we had 13 liquor permits issued, these were in advance of some festivals coming in for the holidays.
Yep.
Private disposal, we had 6 permits issued, contractors are trying to get those last wells and septics done for construction as the summer closes. West Nile surveillance, we did 40 mosquito samples in September. This ends on October 15th. We'll take our last samples and that program will be done for the year. Radon kits, we gave out 15 of them. This was at Lab Fair, which we partnered with IMH. And had a table there after the lab fair about those radon kits. On the second page, yes, our immunizations are going up. We did get our flu and COVID shot inventory in, so we are having flu shot clinics in October, starting in October now. For flu shots and COVID shots, so those are going up. We did have a case of pertussis with a child in September. On page 3. We had 2 new cases of tuberculosis investigated. These are both latent, so got that under control. We've got hemoglobin screenings and lead screenings. We started doing these for the schools now. So we had 7 of those with label. Community outreach events. We had educational presentations. We had 25 of them. If you look down, we had 281 booth visitors. That was at the lab fair with IMH. And we are going around and training the libraries on Narcan. This is a law that goes into effect in January, that all the libraries need to be Narcan trained. So we are going around making sure that all of them in our county have Narcan and are trained appropriately. On page 4, we've got children being screened for vision and hearing. We're back in the schools now, August, September. So we're getting those completed. And then senior services is up this month. If you look at the annual needs-based reassessment 261 this month, there's some cases that we can, intensive casework we can do. When we have a little extra time, a little extra wiggle room, we can go and get those done. It's not as time sensitive, and we've got that third person in senior services now. She's taken off some of that caseload, and we're being able to complete some more of those intensive casework.
Good.
Yeah. And then we had our first dental clinic on September 26th, and we have another one coming up on November 7th. And this is a mobile dental clinic. We're partnered with Community Health Partners. They're a federally funded center. They bring their mobile unit out and they see patients right in the parking lot. It was very successful on September 26th. We had a full schedule, and we're scheduling for November 7th now. It's a service that our company really needs.
I think it's a wonderful service.
Yeah, and they'll take any insurance, Medicaid, no insurance, they'll do self-pay. They're really fantastic.
That's great. Will we be able to keep them coming back?
I believe so. As long as our equipment holds up.
Food truck that does.
It basically is. Their van is amazing. They have an exam room, they can do x-rays, they do cleanings, they have an office in there. It's really nice. Very nice. We also have a new board member, which will be announced at the county board meeting. That's Dr. Danielle Malazzo. She's a veterinarian in Gilman. She'll be joining our Board of Health. So I wanted to let you know about that, and I believe that's all I have today.
Does anyone have any questions, just general questions about any of the bills or anything, or questions for Robin? Her board, of course, approves her bills,
Yes.
but we get to see them. And yesterday she reported at finance.
Yes.
Their budget is finalized. And she's got us running in black and
$272 surplus for next year.
we'll take it. We will take it.
Yes.
Okay.
So that budget on the agenda next month for us to approve.
Yesterday, Finance approved the county budget. And it's on the agenda to approve that budget. If you're asking, is
That's
The Board of Health approves the budget.
yeah,
it chance, and rightly or wrongly, I don't know, said that the county board has needed to do that as well for,
we also the statute,
for years.
the
and
levy
it's
and
never been done, so that's an issue for finance, okay? We got a lot of work to do today. Okay, is that it, Robin?
That's all I have.
Thank you for your efforts and thank you for your report
appreciate
here
everything.
today. And we're glad everything's running smoothly down there.
Thank you.
Alrighty, okay. Angie, it's good to see you. We got a lot of animal
All right.
we've got a lot of animal control work to do yet today. And I spent 3 hours on Sunday and I'm ripping to get some things accomplished today. And anyway, so you go ahead with your report.
Okay, so the animal control deposit was $9,565. We had 58 documented calls with county, which include the following: 18 found and 2 lost dogs and cats, 5 abuse reports, 3 bites, 1 bat, which actually bit a child, 6 surrender requests. Currently, there are 7 dogs at the building, and of those 7, 1 has an owner and 3 are tagged for heart. There are 3 dogs in foster, 2 dogs went to eye care, 1 went to heart, 5 dogs were returned to their owners, 7 dogs were adopted, and 2 had to be euthanized per vet recommendation. There are 2 cats in the building. Of those 2, 1 is tagged for rescue with Cat Guardians of Lombard. There were 7 adopted, 7 sent to Fort Paul Love, 2 to Sunrise, 1 returned to owner, and 1 ill kitten in foster care. I have continued to participate in the spay and neuter days that are twice a month to get a discounted rate. And Fort Paul Love, the one that is taking a lot of our cats, kittens, oversees the spay day. She's in charge of it, the lady that runs that rescue, so it's kind of nice to get involved in that and make those connections, because then she sees our animals and wants to take them.
Okay,
So
very good.
I have printed an animal control manual from another county that I would like to go over with you if we get a chance today.
Okay, why don't, I don't think we'll get to it
That's
today,
fine. I have
Email it out there.
but can
if
we?
it's somebody else's, does it matter?
No,
No,
why don't you
I can do that.
email it to the committee
Okay.
with what you want us to look at.
and we'll look at it. What did you say it was? It's
It's an animal control policy manual.
okay.
I have studied and studied and studied the internet. I can only find one.
I have started a list. I have a list here
This
today.
talks about dress code, it talks about how to intake dogs, it talks about how to clean kennels, it's everything.
Okay,
I mean, it's from 2012, so there's like some changes that obviously we could
sure.
make. That
Well, we've been working on that, so that's
Yeah.
great. Email it to everybody. Amanda, we can put that on the agenda for next month. Everybody do their reading and come prepared to talk about getting some policies on board for animal control.
And I'm sorry I was late. I have a question. I know that we were gonna discuss fees and some other stuff.
Right.
We seem to have an ongoing issue with continuous people calling because they wanna surrender dogs. So, and not all the calls go to ICOM. A lot of times, they know our personal numbers because they've dealt with us in the past. So, we don't have a set fee for surrender or donation for surrender. To me, if we're taking on your dog, we have to feed them, we have to house them, or we have to euthanize them. Either way, it's gonna cost us money to do that. I haven't taken any surrenders as of yet, because if people call me and they have a dog that's just say sick or elderly, I refer them to their vet. I mean, their vet's gonna do the same thing that I'm gonna have to do, so, and we don't have, like, can't keep reduced euthanasia, like, you know, but, so that's like an ongoing issue, and I don't know if it's housing issues anymore, like people just don't have the money to do things anymore. So they don't have the housing but I feel like if we're gonna have to take on some of those, even though we're selective, should they or should they not
Well,
have?
can we discuss that when we get to fees?
Oh, yeah, I'm sorry.
No, don't be sorry, but, I think
I'm
we
50, when them thoughts pop in my head, and
they come out, okay, all right, very good. I think, we need to address that. So, did you have anything else you wanted to bring up before we move on to the things on the agenda? How's the building? Is it put back together?
we're almost done with the stuff up front. He's putting in the cupboards up front, and he's gonna move my, tub up there, so that'd be good.
How everything else getting organized in the back and?
Yeah.
I don't know if I'll have time.
I got shelves that need to go, another set of shelves that have to be put up, and, that'll help me be able to put some of the rest of the traps and kennels and stuff up, so.
Okay. Anything else?
We have an ongoing case with the state's attorney. Actually, there's several cases. He's doing a good job prosecuting things that need to be taken care of. And with abuse, neglect, that kind of thing. And I actually have a meeting with him today on a couple different things with reckless dog owners that let their dogs just run and run and run, and they've been repeat offenders.
That's great news. We got some backup from the state's attorney.
Yes.
So I want to briefly touch on, and I'm going to do it in just a few words. I think most of you know we have this issue with a dog that is racking up tons of bucks. A neglected dog that we took control of, picked up. And
This is one of my euthanasias.
the dog is gone. Okay. So he was served, we have a new tool, a security post that we now know as a tool we can use sooner rather than later. And when I say tool, I'm thinking that, Angie, you can utilize that as this is gonna be an expensive situation. You can surrender your dog, and then we have more options, or you're going to be responsible for all these costs.
And with the post for security, it states right in the post for security that you have 7 days, 5 or 7 days, I'm pretty sure the state's attorney wrote 5, but to post the money, and if you don't, you forfeit the dog. So, or a cat,
Right, so we can use that as a tool to avoid these extreme expenditures in the future.
He did have to continue that case, because if they get a lawyer, it becomes
Okay,
but
so he did get a lawyer?
he stood in front of the judge and wanted a continuance to retain an attorney.
Okay, has he produced any money?
No, because it was continued. So that doesn't even get put before the judge to determine.
Okay, so that's an ongoing
Well, it
issue,
is-
and,
It is a case that Quinlan is pursuing
Oh,
felony
yes.
charges on.
right,
So we had to pay for an autopsy and some other stuff too, because that was,
So you're not talking to this in here, he's talking
Oh,
about.
right. I knew that, I guess I didn't share that.
No, that's fine, I just
The
want
2 felonies, wasn't he, Chuck?
yes, yes,
Two felonies,
yes. And I know in the future, we can ask them to relinquish at any time. That was not gonna happen in this case.
Right. And do you have a total of round numbers? I'm not gonna hold
I'm sorry.
20? Oh, Lord. Okay, so.
Oh, sorry. You're good. Sorry. Instead of taking it out, talk to the person, tell them we're gonna take it out. Instead of
This is the question for Angie and Jill.
No, he had to be taken right away.
really,
Yeah,
Okay,
because the way that the Illinois Department of Ag works, when you have a case that you consider, and I'm sorry, Adrian.
no, you're good, you do
I've
it.
been trying to like step back and like take
No,
over and
it's
we're
okay.
getting down to like the last couple months. Before I sit free. Anyways,
It's okay.
the
Yeah,
Illinois
yeah.
Department of Ag, what it's called is an emergency impoundment. And if you have a humane investigator, it has to be done by a humane investigator, which we do. At one time I had 3 of them, I'm down to 1. Angie is signed up to take classes, to get her humane investigator license. So Jacob Williams is our humane investigator on staff, and what he did is he made the determination, he graded the dog and spoke with Joel Asherman from the Illinois Department of Ag, and it was deemed an emergency impoundment situation since nobody was available and he could not be contacted. So took the animal in, on those basis and got him vet care right away. And he was improving. The dog was happy, it was responding, and then something along the way, he just quit responding and he just kept going downhill. So unfortunately, since it was a court case, Angie worked with Mike Quinlan on, when and if we can, make the decision on whether or not to euthanize. And since it was an ongoing court case with an owner that was unwilling to relinquish or, do what was best for the dog in that case, we had to have a vet's opinion on whether or not they would euthanize the animal. So unfortunately, after 3 different vets' opinions, the dog ended up at the University of Illinois and was there for a couple of days before their vet team decided that it would be in the best interest to euthanize because there was nothing else they could do for him. So we were kind of stuck in this case where we didn't have the right to take the dog and do what we wanted with it at the time. But unfortunately, we had to emergency impound it because of its medical condition and because there was no contact that was made and no relinquishment paper signed.
Now, I would interject that if I went to your home and I saw your dog in this condition and you had vet paperwork that showed you were actively trying to figure it out, you would not have impounded the dog.
but no one talked to him before he actually took the dog, correct?
Nobody
You
was
don't have
home, we don't have to. There was no home, no food or water, nobody was home, and there was packages on the porch that were old and made it seem like possibly there was, I don't know it, the people from around here, so we were concerned about the well-being of somebody being in the home when they passed away.
You think the delivery driver would know that it was a family that lived there with 3 kids, not some elderly person. My delivery driver knows me. You know what I'm saying?
This delivery driver, I don't think had ever been in that home before, because when they saw this dog, they were beside themselves.
And they had every right to be
Yes, they did.
beside themselves, because I'm sorry, if you were a pet owner and you have a family, you have kids, the state of this animal, you could see every bone in his body. We had never had any record of him being registered or vaccinated, and we have yet to see any sort of vet papers from these people. Now, one of the issues that was going on with this dog is Lyme disease. No vet or no over-the-counter flea and tick medication was given.
No.
I mean, this was pure neglect by.
And his kidneys and organs were failing due to no food, no water.
So I hope that helps us to better understand what a pickle we got into. You're no fault of our own. But I want to move on now to number 7, discussion and action on adding spay neuter claims to the pay now claims list. The reason for this is when animals are taken to spay neuter clinics, as I understand it, the bill has to be paid. So we are working out a way for, it can't be paid after the fact, like 30 days at the next county board. We have certain bills like electric and I can't remember some utility bills that are pay now. So do you have questions? Do you all know how the pay now list? Is this an appropriate request? So how would this work, Angie?
Can we add rabies to that? Or rabies vaccines?
Because rabies has to be done by a vet. We cannot administer rabies.
These are the other ones.
And they have to be paid at the time of service. So do you take a check or does Jill issue a or
Right now, I'm paying them. I understand.
No,
I know.
yeah, see, we've gotta get Angie Frary off the
You-
claims list. Yeah. We've got
Animal
to,
control
That's why
pays
I'm asking for this.
so what you would do is she would come in and say, I'm going to a spay neuter clinic on Sunday and I'm taking 6 cats and I need $300. And you would issue a check.
We've been issuing a check, and then Angie brings me the documentation to go with the claim.
Okay, so it's getting approved
But
after?
some of these emergency vet care situations, like with this dog, they wouldn't take him unless she put down a retainer. Well, this happened to be on a weekend. And we're here to cut a check.
Well, I
So
understand.
there's just some things that we're running into with animal control, and this has always been an issue, since Dr. Yusuf left, that, vets anymore, they, it's just like the hospital, they wanna make sure they get paid, so.
They want paid up front.
so,
Okay, ideas, thoughts?
one, I'll move to add spay neuter rabies claims to the pay now. That's my motion. Second, what I'm gonna say has nothing to do with the motion, but
Well, wait a minute.
once there's a second, then I have more comments.
Okay. Anybody want to second that motion? Steve Hughes, okay.
Okay.
So discussion.
Yeah, we need to have the pay now thing, however, you need to, and this may involve Jill, get with the state's attorney to draft a policy that says you are authorized to use your personal funds to cover certain events, the weekend retainer fees or whatever, because you should not be using your money. I mean, it's not like you are going on a training where you're gonna pay the hotel bill and food, and then you turn in a reimbursement. So, but that's even in policy, okay? So, need to brainstorm some of the events, and it needs to be in policy, state's attorney, this way you're covered. Because it's a slippery slope of mixing too much personal and government. I get the whole receipt thing, but I think we just need to have something that protects you, protects the county, but also authorizes you to.
Would it be unreasonable to
I just want the state's attorney.
get an Iroquois County Animal Control credit card?
Ask the
Send it
state's
to
attorney.
mail.
It's not unreasonable.
I don't think it's unreasonable.
I'm
Let's-
just asking the committee,
Yeah.
because you guys would be able, you would be
This
the
is-
ones to.
It's not unreasonable. I would prefer that
Yes.
over, but still there needs to be a policy that goes along with authorized.
Credit card use.
Right, exactly.
Or if it goes to exceed a certain amount, that you call someone to say, hey,
Yeah.
here's the situation, they want 10 grand, whatever. Whatever the dollar threshold, whether it's calling the chair or whether calling you or the chair, But that's where our state's attorney gets paid.
Okay, this is
Yeah,
where
so
I
that's a
would
separate.
add, Angie did apply for the credit care card.
We cannot.
We
use
cannot
credit card
have
card
it.
Because we're government.
Right,
We looked into it.
that's what I was gonna say.
Sorry, Don, I didn't know if you knew that or not.
He
Yes.
said all businesses, it's only personal use.
Yeah, Angie filled me in on that, so we are, there's that 20%.
Yeah.
A reduction or whatever that is out the window. So I want you both, or one of you, to work out or to work together to talk about a credit card for animal control and how we would utilize that, protect that, and authorizations on that.
Yeah,
Because,
we have them in other
Yeah.
departments, so we could.
Yeah.
Yeah,
so we
could
wouldn't
just
be
look
rebuilding
at their
the wheel.
policy and see what that
Okay.
is and
Yeah.
adapt it.
Okay, why don't you bring that
Awesome.
back to us in November, because it's not right that Angie is bringing her credit card and paying, we've gotta get a policy here on that.
And if I could, one more thing, because I know there's a lot of questions about this case that we paid a lot of money on. At some point, you have to have one of those that you're setting a precedent. You know, you're starting a department from the ground up, we're no longer gonna be, allowing people to do this and get away with it. We have a state's attorney that's backing the department now, and actually, there are 7 cases going on right now through our state's attorney's office that involve animal abuse and et cetera. So, you know, this seems like, oh, we've done what? First of all, these are very far and few between, but second of all, you know, we need to have a way to set the precedent that we're not gonna do this anymore,
Right.
and that we want you to pay your registration fees. We want you to microchip so that you're responsible for your animals that you took in. If you cannot be responsible for them, then you should not be taking them in.
Right, right. And I want that message out in Iroquois County. Don't come here and plan to start your puppy mill, abuse your dog, ignore your animals, because we are on it and we are functioning here and we will take action. So, okay, so we need to vote on our motion and our second to add to the pay now. We call the roll on
Hughes,
Yes.
McGinnis.
Yes.
Barr,
Yeah.
Grant,
Yes.
Crowe.
that. Yes. Okay, we're gonna move on to our animal. Actually, I didn't ask to move. I'm watching the clock. They've got a lot of business too, but I wanted to get to the intergovernmental agreements. And I think there'll be quite a bit of, discussion on these fees. Well, actually, they kind of go hand in hand. Okay, first of all, this is simple. I got from the health department, this is insurance because we use personal vehicles. And we need to know that those people are employees acting in a warden capacity, are properly insured and registered vehicles. So this would become part of the hiring process, I believe. We give this to Jill and they would, or Amanda, whoever does the hiring package, Amanda, I'm sorry. This has them present their proof of insurance and their registration. So I would like a motion, I'll pass this around. It's the same wording, I don't think we have to have this approved. What,
Does this get rechecked like once a year or?
it should be annually, I think we have that in there.
Is that something I would check going forward or does it go to Amanda?
I think you could put that in your policies thing, that we check that once a year.
Can work.
And
Because
then,
if there's employees that don't have, I mean, man, it's just talk to you, say, hey, you need to give these
Yeah.
free and help me.
Okay.
and so what I think you would do is they would give you the insurance card annually, and then you would pass it on to Amanda to have it on file. I'm gonna ask Amanda to change the wording in here from Iroquois County Animal Control, it says public health. And so I would, and then we'll make this a part, as I said, of the hiring package. So I'd like a motion that says all of that, please. Steve, you gotta say the words.
Oh, I make a motion to add verbiage to the hiring process or whatever.
Proof of can I add to
Yeah,
yours?
The only
Proof of insurance.
Proof of insurance registration to present it annually.
Okay.
The only thing,
Do we
yeah,
have a second for that? Roger,
the only thing I would definitely state in there is annual, and that could become a county policy as a whole down the road, I mean, full-blown county-wide policy. Because it's the background check, which we need to do.
and
But
we're
then-
gonna do background checks because we shouldn't be hiring.
But then down here it talks about copy of valid driver's license and auto insurance must be attached, but we need a policy about that. This is the background check. I'm not seeing anything that says you have to maintain a valid license and minimum liability is all.
Okay,
That's all. I just see the first part's all background.
right.
And then, just
Let me write on that, please.
so. And that could be a county policy that just needs to be adopted, that any use of
Oh,
county.
we'd have to, would that have to be an ordinance?
No, it's good.
No, it could
County
be a
policy.
policy that would be drafted and approved by the Policy and Procedure Committee.
And then by the board.
So they have to provide that annually, and what's the other thing? Make it a, for now, we're gonna put it in animal control policies and hiring practices. Okay,
But, because we already run a background check on new employees, no?
It's department
It's
specific.
department specific. Right now, the only,
I would recommend you have that discussion with the next PFP.
well, okay, I can do that, I'm not gonna be at PNP Thursday, but
I can bring it up.
Yeah, that we should have a general background in general, and then auto is my recommendation.
So
This way we're
background and
covered.
auto use.
well, I think we should do backgrounds in animal control
Yes.
because we're dealing with the public, there could be children in homes and
Yeah.
various other things.
Well, you're a peace officer, so you should be getting background
Yes.
checked.
Well, that's the
No,
word
that's a
they
separate-
use, but they don't
yes.
have police powers.
Yeah.
They can write citations,
Yes.
they can,
You're
They
That's
don't
what I'm
have
saying,
police
you are a peace officer, so you should be,
you are dealing with compliance and inspections, and you have the authority to write citations and stuff. But
Okay.
I'd be careful on that wording until the
so
state's
that's what's
attorney.
in the book, the statutes.
that's the
And
word.
you can be, yes.
So anyway, I'm adding to produce this annually. We want to make this a policy of animal control. And
Definitely.
maybe, and Amanda, I'm gonna put this on you to retype this and make it read right. Maybe Mike Quinlan can tell you what we need to put in their words about making it a policy of animal control. So we have a motion and a second.
Well, Donna, if we're gonna make it a county policy, if we're talking about a background check and a personal auto use policy for the county, it wouldn't necessarily have to, and you guys don't have policies yet, you have a manual that Angie found
Mhm.
that you still need to discuss, so that would be tabled until y'all can review it and discuss it. May I suggest that you just move to, have these go to policy and procedure, since we're gonna make them a county-wide policy? And you haven't had a chance to review the manual that, Angie has found for animal control policies, because there might already be one in there.
Okay, well, I
I
guess
mean,
it's.
that's just a suggestion.
Yeah, I would.
We're not planning on hiring anybody in the next 30
No.
days, so I guess we can do that.
I'd like to see that, I didn't even get,
Oh, you didn't see it?
no,
Okay,
they
all
just
right.
passed me
Well, I've
by.
only got one copy of it with me, but you can see it for sure, Roger. So let's decide what we're gonna do with this. We're gonna table
I mean,
it
that's just my
I would
suggestion, if you're gonna
send
table
it
your
to
policies, but you
PNP.
haven't seen it yet and had a chance to review it, but
and,
you wanna make these county policies, so just have them go to policy and procedure.
Yeah.
So we'll make sure that gets on the agenda for discussion.
for policy and procedure Thursday, I'm not gonna be here.
It won't be, it's too late
Too
to put
late.
on the agenda.
Okay,
It's okay.
so put this on the agenda for next month.
Yeah.
Read what she's gonna email us. Let Roger look at that, I want that back, Roger.
And I don't have a problem, I can talk to Paul and he can bring it up in,
Yeah.
in new business, that this is something we're gonna be looking at.
Right, and I think it only needs, we don't want a background check every new person that comes through the door. Do
Well, I
we?
mean, it
Yeah.
wouldn't hurt, we pay for the programming, through the planning and zoning office, so.
Yeah.
Yeah,
Okay,
you really should have one on
Okay.
everybody that works in.
all right, this will be on the agenda next month. If it seems like I'm rushing, yeah, the clock's ticking by and I wanna get things.
That's fine, I just didn't want you to start running before we walk, cause
Okay,
nobody's had time to review any of it, and it hasn't
Okay.
even been approved by Quinlan.
so I'm gonna ask Amanda to retype it, well, but I assume Quinlan approved that for the health
Policy and
department.
procedure.
I don't know if Quinlan approved that for them or not.
Okay, send that back here when Roger gets done and we'll work on it next month again along with the manual Angie found.
So table those two, Angie will send out the information, I will talk to Paul to bring it up in new business, that those are gonna be county policies that we would like to implement starting, or for discussion and action next month.
Okay,
I mean, that's just my opinion.
that's what we'll do.
No, that's,
That's fine. So then I want to move on to intergovernmental the fee schedule. Okay, do you all have a copy of the fee schedules?
no,
Okay, you all had intergovernmental agreements.
no.
I had emailed out what we had on file, but that was a few months ago. I wasn't asked to re-email out or print anything, so, if you
Okay,
have them, they're still in your emails.
okay. These date from 2010 and 2011. We need to update our agreements with villages. I read through this, I think it's okay. They automatically renew year to year. I want to make a copy of this before I go. Unless we just continue them 60 days beforehand. And I don't know the dates on any of these. I'm not sure we have copies of them anywhere in the records. Do you know that, Jill?
We haven't been able to find them, I checked with Brian's office, she could find where they were discussed at one point, but,
So
not something we've been able to find.
I'm gonna pass this around. I think it reads okay. We should probably set this before Mike Quinlan again, the state's attorney, for his review. I would like your thoughts. I know this is
You want a
unfair.
motion? Send it to Mike, or you just? gonna
Well,
send
I'm
it
just
to him?
gonna send it
Okay.
to him. So let's move on to these fees. So these are the fees, since we're talking about villages. It was $65 per trip for dogs to be picked up and transported from within the village, the city by county animal control. So that's if our personnel go and get the dog or the animal.
It's 85 now for our people to go.
Well, how'd we change that?
It's been like that since I inherited that, it was 55 for investigations, 85 for any transportation, and then, we implemented the 55, for kennel duty, once we got the building.
Okay, I'm not against that, but I'd like it to be 100 because we're paying our wardens $85.
I would
Plus gas.
say before, I mean, I run into this all the time with like school boards.
Plus mileage.
Let's not just pick a number, let's
Right.
actually pick an accurate number, so does the data say that the number, what's the break even
Well,
number?
we already have $85 in place.
Yes.
That we're paying them, we also pay them mileage, so depending on where it's located, that would.
So it needs to be written, either, something needs to be written according to distance to each town,
Right,
I'm writing it here, Chad.
or
I had
we
it
need to
fee
have a
for
higher
minutes
fee
for
where
minutes.
it's average. So close one might pay a little more, the other one may, but I don't want to just pick I don't want to just pick a number.
and we do have general fee, schedule that was,
That's a big charge. They charge 100.
that Kankakee County Animal Control shared,
Yeah,
so,
I think Angie needs to look and actually
and
look
it
at
was.
the real.
And I left out one, the $15 a day for boarding was also in there, but I think they need to be increased to 20 because of the fluctuation of the price.
Yeah,
Well,
I
wait
just
a
like
minute.
data driven.
We're mixing apples and oranges here. I want to stay on fees for villages
Yes,
that go with,
Yeah, this
That's
would be
what we're
part of that now.
well, yeah, I know, but it's not another doc.
Well, that's accurate, that's their fees. This one cannot be changed, the public safety. That's
Yeah,
in the
public safety
statute,
statute.
25.
And we want to add a surrender fee to that as well.
He charges a daytime hour fee and an active hour fee.
Well, that seems reasonable.
And if it's one officer, it's one fee. If it's two officers, you get charged for two officers.
I would,
So and I don't normally have to do that, there are times if we have, say, 3 dogs, like we have in Clifton that are running loose, it would take more than one of us.
I moved the table, the animal control fee schedule, and the, updated recommendations from Angie on what the fee should be. Separate out what are statute fees, so we know we
Okay.
can't change this.
That's what I spent all my time reading on Sunday. The statute, the animal control statute clearly says it's up to the county board. I then went to the ordinances to see if there were fees in there. There are not. It's
No,
what's
she's,
on file, what we decide we put on file in the
Yes.
clerk's office.
yes, well, Angie mentioned this one was
There's
statute.
one, the $25 one is
So that's all I'm saying is,
That's the public safety.
Safety, yes, that
Yes.
is laid out by the statutes.
Right.
So-
That is the only one that I have read, and I have been reading them religiously because I find something new every time.
I know.
so what the real cost should be, not just, I think it should be 100, or I think it should be, it's data driven. You know, we're
Just so you understand, what we charge the city, so say we charge $100, okay?
Yeah.
I'm charging Martin $100 to go in there, I bring this dog. I'm still charging the owner the same price that we have listed.
Yeah.
So we'd be collecting the 100 from the city, plus the 85 the owner has to pay to pick up the dog.
Yeah,
Yeah,
so
that's the big
Chad saying he just wants a
Oh,
little
yeah, I got you.
evidence to go behind what we're charging, so that when we do present these intergovernmental agreements, we have something to back up
Yes,
what we're charging these people.
and why,
Because they're gonna wanna know, they ask.
and the public too, and then this way it looks that we are actually using real data to decide how we're conducting business.
Yeah.
And that
You're
we're
telling me
not
what,
just,
like, you want me to take, like, just say a year's
Yeah,
worth of transports and a year's worth of whatever and average it out per
You-
call?
No, I'll
whether-
help you do it.
yeah,
Okay, I got you.
whether it's average or whether it's based on each village a little different because of
Yeah.
distance.
Yeah.
Or,
Okay, I got you.
I don't necessarily care on which direction, it's just, we don't just pick a number.
No, I will, I'll help you do that.
Okay, I got you.
Okay, just a
Yeah.
second.
You know,
So,
there's not a
I got
set
it, I
spot.
understand.
Okay,
well, you know, it's gotta be what's.
all right, would you, we need a motion?
No, Chad made a motion to table the fee schedule pending Angie's recommendation.
Okay, do I have a second?
Sure.
All in favor, aye? All opposed, same sign? Okay, when you two meet about fees, just for my edification, will you let me come to that, will you let me know when that meeting is?
Absolutely not.
Okay,
No, I'm just kidding.
what,
Yeah.
Ann?
Does this include what, like, fees that are rehoming fee?
Look
Yeah,
at
we'll
law.
talk about it on.
Yes, everything, surrender, rehoming,
Okay,
adoption.
I usually have to do, so I didn't know, fees is it or that,
Yes,
everything.
let's get all of our fees
All
up to
monies.
speed. So
All
I
monies
guess,
involved. All monies.
all monies,
We'll
right,
talk about it.
Sorry, I'm
okay.
not trying to put it on your plate.
Yeah, well,
but-
you just foul up everything, child. Okay, so I'm gonna go ahead and put this intergovernmental agreement in front of Quinlan, okay? And at least we'll have that approved for the next meeting.
Does that mean that any of these things from Kankakee County, I have to have approved from you guys to put before Quinlan?
What
No.
things?
I don't.
You can talk to the state's attorney on
It's
anything you want.
paperwork.
Yeah, you can talk to him,
Forms, you mean?
Yeah,
Okay,
yeah, no, you can talk to him on
well,
that.
after you talk to him, bring them back to us so we're at least aware of them, you know?
okay.
You know, the documentation that, I inherited from Dr. Yusuf was
Yeah.
basically none.
Yeah.
So
And it's
created
probably outdated.
a few items of paperwork, just as the intake and bank transfer papers, but Angie's been working with AEP and they have offered to share all their information and their vendor, so that we could just change Kankakee County to Iroquois County and whatever else we would like to change. Because they have a lot of good paperwork that we really should probably start utilizing.
And it's, what do you call that, like with the copy?
Oh, triple paper.
Thank you, it's so the,
Perfect copy.
it's hard copy, thank you. So
Okay,
that the notice would stay with the people, we have a copy of the notice.
okay, where are we?
Update credit.
Oh, we have,
Problem.
I already
You
threw
did
that
actually.
in there.
Yep.
Department policies have been discussed,
Credit card system.
credit cards, oh, how about, Square? We have that, it's up and running,
Yeah.
how is that?
I'm gonna check with Jill and see if my little piece is in, because right now you're only able to do like, we'd only be able to do it on internet. I haven't had to take anything yet, so, but we do have the capacity now. But they're supposed to be sending a little cube that connects to the phone that you just swipe. So,
Okay,
haven't seen that yet, but we do have a system.
okay, very good. That, we're gonna skip executive session, there's nothing there. Can I have a motion to approve the claims, please? Roger moves to approve the claims.
Sorry.
John, is there any discussion or questions about the claims? Okay, yes, and, yes, Amanda, please call the roll.
Hughes, McGinnis,
Yes.
Barr,
Yes.
Grant,
Yes.
Crowe.
Yes, I would note that just for the committee, that we're watching, I think we've got 9% of the budget left to get through till December 1 or November 30th, whichever you prefer.
2 months.
So we need to mind our pennies.
Well, and keep in mind too, this is the first actual budget that we put together as animal control as a department. So we did a lot of estimating, and the space did put us over quite a bit. So, I'll be making budget amendments, after I get to finalize the fiscal year, so those are coming.
Okay, I have some budget questions. Well, you'll note I just mentioned that there's $14,000 budgeted for animal care. Or veterinary medical expense, I'm sorry, for 2026. So you can see how easily that could go out of whack. Jill, is there still, at one time there was $15,000 in the budget for a vet? Did you take that out? Is that still in here somewhere?
In the 2026 budget,
Yes.
so it was the department head. So 15,000 for the department head, that's what we were paying Dr. Yusuf. But that got changed, now that department is Angie, so we're paying her from there.
Okay. So we do not have money in there to hire a vet?
No, because
Like we were
we didn't
talking,
have anybody signed up, so we just have veterinary medical costs for the
okay,
year.
okay.
So
Now,
we don't have anybody that,
I also noticed someplace our service contracts, and I think this was in the 2025 budget, they were really high at one time, and then they came down, and I didn't understand that.
since originally we paid for a lot of the building upgrades, we paid them out of there, but then I had talked to Chris and asked him, because technically those are building maintenance items, if we could utilize some of his funds since he had not been utilizing a lot of his funds and it is a county building. So we moved the flooring, some of the painting items.
Well, that was this year, but these were in previous year budgets.
Oh, well, that's because the animal control officers that we had, their pay came out of that line item as well as it came out of that line item and they got paid mileage and
I
gas.
see.
So, a lot of that has been taken off of that place and she hired Angie as a full-time department head, she's been taking a lot of that for her.
Okay, I have one more thing, and that's this Muldoon trust, this animal trust. So on Friday, I called the gentleman, Jim Pores, but I'm not sure it's not Forrest, in Vermilion County. He's an elderly gentleman. The history of this is, he and Dr. Fennell worked out something for Vermilion County to take our adoptable dogs.
Yeah.
For placement, and the agreement was transportation meet halfway. So Dr. Fennell worked with the trustee to get Vermilion County to take these dogs. Suddenly dogs stopped going to Vermilion County, no one knows why, but he did say, the trustee did say he had conversations with Dr. Youssef. The trustee reported leaving multiple messages at the county and not receiving a call back, and he said to me, it's too late. So, he's given it all, I don't know all, to Vermilion County. So this leaves me, and he says it's just the income from the assets. So I have lots and lots of questions here about whether we're entitled to income. I really am trying to track down a copy of the trust instrument. We really need to see that to see what it says. He is the sole trustee, his decisions are final. He can only agree to things orally, he can't enter into written contracts, he told me that himself. He says this is a charitable trust registered with the state of Illinois. I'm not gonna go that direction. I called Angie because Lisa was out at the circuit clerk's office. This was like at 4 o'clock on Friday. Asked her to do a quick search. We came up with his name, Muldoon. Nobody has any information on this. Nobody has a copy of anything. Nobody knows what's going on. So I'm literally trying to ferret this information out one piece at a time. So I called Ben Brian at the county clerk's office, and she's the one that came up with James M. Forrest was the executor. She gave me a probate number, so now I can go back to the circuit clerk's office and see if there's something there. Plus, she gave me the name of the attorney, and he's in System Park still practicing, so I can call him. And I also plan to call the Vermilion County, maybe animal control or a past chairman, and see what their recollection or their knowledge is. So that's where that's at. It takes a lot of time to dig around and stuff like that when we don't have any information. So, yes, sir.
We dealt with that, with Jim Forrest on that probably 5 or 10 years ago. And it was tabled, nobody ever moved on it.
Really?
Yeah.
I have no
There have been,
recollection.
records, I don't remember exactly what year it was. Because, yeah,
That's a shame.
he's used to the bank president in Young First National.
See, and you gave me the name James Pores, and I'm wondering if it's not James Pores.
No, it's Forrest, Jim Forrest.
It's
Forrest.
Forrest. Oh, well, you had it written down as P-O-R-E-S. But anyway,
ENF looks similar.
I mean, no, I have Jim Forrest written down in my office too. I don't know.
okay. Angie, I want to show you something I found in the ordinance and discuss that with you after the meeting. We talked about including microchipping in that. Oh, we didn't talk about that, did we? Did we talk about microchipping?
We would probably talk about it in your policy that you want to implement, right?
No, I want to talk about it, having it put in the ordinances.
Yes.
Oh,
And I talked to, Brian about it yesterday. She's getting me some more information about that. Okay. Are the ID badges done, Angie?
I sent Jill a couple of pictures, I have still 2 people that haven't sent them pictures. So,
Okay, we need to get those done. And I think that's it. Unless anyone has anything else. I really wanted to get some other things approved today, you guys, but
It's okay.
next month. I do think we moved forward, we made a little
It's okay.
progress. Anything else from either Jill or Angie?
No.
Okay, move to adjourn, motion to adjourn. John and Steve. let's see. Yeah, he's gonna copy it. Okay, we're adjourned. Thank you.